Welcome back. While vaccines are quickly rolling out for those over the age of 16, younger teens and children are not yet eligible to get one.
That's right. And some parents still aren't sure they'll want to vaccinate their children once there is an option. We talked to one of the country's top experts in childhood vaccines about his thoughts on the importance of vaccinating kids against COVID.
Children generally get the disease less frequently, and when they get it less severely, but they can still spread the virus. And so I think for that reason, plus for the reasons that children can still suffer and be hospitalized and die from this virus, if we can prevent it safely, it's worth preventing.
Dr. Paul Offit is director of the Vaccine Education Center at the Children's Hospital of Philadelphia. He's also the co-inventor of the rotavirus vaccine and a member of the FDA's Vaccine Advisory Panel, which has voted to recommend each of the currently authorized COVID-19 vaccines.
I think when people sort of hear emergency use authorization, they would assume that at some level, safety guidelines are being ignored or sort of critical stages of development are being cut. But that's not true. I mean, when we look at these data, I look at these data the same as I would any licensed product. We hold these all to that same standard, which is it safe? Is it safe? Is it safe? Number one. And is it clearly effective? And has the company proven what it's claiming to be true? And ultimately, would I take this vaccine? Would I give the vaccine to members of my family? And then and only then would we recommend it for other people's families. So it really isn't any different, the process.
Offit is concerned about the risk of COVID in children.
Even if you just look at death in children, about 184 children died last year of COVID-19.
He has treated children suffering from MIS-C, a multi-system inflammatory syndrome that develops weeks after kids appear to recover from a mild or asymptomatic COVID infection.
They presented with evidence of heart damage, liver damage, kidney damage, and high fever. And who knows how long this is going to last.
Offit hopes the clinical trials in children will ultimately be reassuring to parents.
I can understand where people would be nervous about messenger RNA vaccines because it is a novel technology. But keep in mind that there are a couple 100,000 genetic pieces of messenger RNA in your cells all the time. This is just adding one more.
He says in many ways, the vaccines are simply remarkable.
I mean, if you asked any scientist on this planet in say a year ago, do you think we would have a vaccine that's 95% effective, protective against all manner of illness, mild, moderate, or severe disease, just as effective in people who are over 65 years of age, just as effective in people who have a variety of comorbidities, just as effective in all racial and ethnic backgrounds, and is safe in now tens of millions of people? No one would have believed that, me included. So I think it is a gift, this vaccine, and we should accept it.
And we asked Dr. Offit how the risk for kids will change once most adults are vaccinated, but children are not. He said masks and social distancing will remain critical for protecting kids until they too can be vaccinated. Doc?
Well, with more people getting the vaccines, we are getting a lot of questions, including whether the vaccine will make them test positive on a COVID test. None of the vaccines can cause a COVID infection, and they cannot cause a COVID nasal swab test to become positive. Now, viewers have asked if there is any way to test whether the vaccine worked by checking their blood antibodies. The answer there is no, particularly because some antibody tests don't detect vaccine-triggered antibodies, and they might be negative even when you are protected by the vaccine. Now, most viewers are aware that it is possible to develop a sore arm or other side effects after the shot. So logically, they've been asking, if I don't get side effects after the vaccine, does that mean it didn't work? The answer is nope. Some people just tolerate it better than others. If you don't have side effects, consider yourself lucky. Side effects don't say anything about the effectiveness of the vaccine. Now ahead, I'll answer more of your questions, including, do vaccinated people need to quarantine after an exposure? And why do they collect insurance information before a vaccine if it's supposed to be free?
Yeah, those are good. Okay, we look forward to that. Dr. McGeorge, thank you. Scam artists are crafting new schemes every day to cash in on your choice to get vaccinated. Help Me Hank shows us what to watch out for.
And Dr. Fauci back with the science behind the COVID vaccines when we come back.